Welcome to our podcast, Dr. Diaries Adventures to Ireland. I'm your host, Graham. The aim of this podcast is to showcase doctors' relocation journeys to Ireland. So whether you're a doctor interested in the move or just curious about life in Ireland, this is the podcast for you. Now, let's get into today's episode. Hello and welcome to the latest episode of Dr. Diaries Adventures to Ireland. Today we're joined by Laura. Laura, thank you so much for coming on the podcast.
Thank you for inviting me.
Yeah, so tell us about your journey here to Ireland. If I recall, the last stop before moving here, you were in Tenerife, working in pediatric emergency medicine care. Bring us back to Tenerife once the idea of moving across here came to your mind.
So it's been a big change coming from one island to the other, but
Sure.
I was actually in my gap year when we contacted. I had finished my training in Tenerife in pediatrics, and I was thinking about what my next step would be. And then this idea of moving abroad just popped up. I found you on LinkedIn, and I don't quite recall how it was, but it was me who contacted you.
Yeah. And now tell us, you jumped into a pediatric emergency care role in Crumlin, in one of our large Dublin teaching hospitals. Talk us through your first few days there and what the role is like to you today.
So I've been now almost 5 months here. In the first week, I could say I was really nervous, really anxious for the change. But looking back, all that I remember now is how welcoming people were, how helpful, and how they made things much easier for me.
Yeah, and I'm right in saying you had a friend already here.
Yes, I did. I'm actually living with her, so that made things very easy for me as well. Yes.
Yeah, absolutely. And we say this all the time. If someone knows someone here or if they've been here as a tourist, it's less of an alien move, but even better for you. You're able to move back in with a friend and experience living abroad together whilst you work in medicine. And what space is your friend working in?
She works in marketing. Nothing to do with my...
Very good. So jumping into the job, how have you found it? How have you found working in Crumlin Children's Hospital?
So honestly, I must say it's quite similar to pediatric in Spain. I found myself like really working as a team and doing things more or less the same that I would do in Spain, but I'm learning a lot from emergency in pediatrics because here there's a lot of workload and it's one of the main hospitals in Ireland. So we get to see all sort of cases and it's really interesting.
Yeah. And talk us through those cases. Have you found many differences between Spanish patients versus Irish patients?
One thing that surprised me at the beginning when I came here is the amount of trauma that we can see, because in Spain it would be the orthopedics who would take care of these children, and here the first aid it's always the emergency department. So I'm learning a lot of stuff about trauma.
Yeah, gosh, and quite an adjustment if you're not that used to it. How did you get up to speed?
So I've been studying a lot. I just came back from doing a course in pediatric trauma. I'm learning, and also we have the backup from consultants and from the nurse team, which is amazing, and all of the team in Crumlin. It's really good when something goes wrong. You've got help from ICU, and everyone comes down and help. So it's been great. You never feel alone.
That feeling, did you have that when you were working in Spain? Did you have that same support, or how does the system compare that way?
I did have the same support from my consultants, but the hospital, it wasn't a pediatric one. It was mixed with adults. So we didn't have like the specialists on site. whilst here you've got everything you need.
Okay, and that's I guess best environment to deliver the best possible care, right, for the patients that need it most. Yeah, amazing. And in terms of, I know Ireland and Spain aren't too far away from each other. We get plenty of Spanish tourists, and likewise, you welcome plenty of Irish tourists. But there's still that cultural difference too, and of course that language gap. Talk me through how you adjusted, or perhaps even prepared ahead of moving to sort of bridge that language gap.
So yeah, this, I would say, it would be a piece of advice to anyone from Spain thinking of moving to Ireland. Speak as much English as you can before coming. Read in English, watch movies in English, because in our field, communication is very important, both with parents, with children, with patients, and with your team. I'd say it's one of the biggest challenge that I faced once I moved here, because I had never worked in English before. I learned English at school and I've been practicing almost all my life, but I never used it in my workplace. And it's a big difference. Like medical terms, they're something different to slang, for example. So reading articles, I'd say, was a good option. And yeah, just as much English as you can speak before coming, it will make things easier. Because for me, the first couple of weeks, it was all about adjusting, about learning all the abbreviations, all the medical terms. But, everyone understands. And my feeling is everyone is just there to help you.
Yeah, one nice piece to end that on, that everyone is there to support you and ultimately, as you say, give the best possible care. That's the language piece. In terms of culture, obviously you moved in with your friend who's also from Spain, so you still have that Spanish element. But have you found other Spanish people here, or have you gone to attempted Spanish restaurants here, or what have you done to sort of embrace the culture?
So I already knew because of my friend. She's been living here for 2 years, but there's so many Spanish people living here. You can almost, like, when you're walking around the center of Dublin, you can hear Spanish everywhere. Lots of people working here. So it's quite easy to get into a group, Spanish group, a community, and that really, it's part of why I'm so happy here, because I get to work in English, practice that, and then once I get home or in my free time, I can also speak Spanish, and part of the culture is still here with me.
Amazing. And it's that community piece is really important, is it? Whether, like you're moving alone, or whether you're moving with your partner or your wider family, you need to find your community, because otherwise you'll feel quite lonely, won't you, on such a big move across, whether it's from Spain or other parts of the world. In terms of the patients, again, and one thing within pediatrics that just adds that extra layer of complication is you're dealing with a patient, but also the parent. What have you found in terms of sort of patient expectations that differs between Spain and Ireland?
Well, I should say here, my experience is parents are very grateful. They know that we have long waiting times, and they really appreciate your work and always thank you when you're done. And that's really, it's very nice. It's something that I must say we don't get that often in Spain.
Okay, really? Okay. And it's very simple words, isn't it? It's as simple as a thank you. It's a simple piece of appreciation for the time and effort you've gone to help with their child. And that goes a heck of a long way, I'm sure, to keep you going in your day.
Yes, exactly. It really makes a big difference.
Great. And in terms of going outside of work, in terms of life here in Ireland, what's the most surprising aspect that you found from living and working here?
So I'd say Dublin as a city, it has a lot of activity going on, lots of people in the street, always the pubs, the live music 24/7. And people are so nice. I know we've heard this from the outside. we've no, like Irish people are known to be friendly, but it's not until you get here that you really get surprised. It could be anyone in the street or at the pubs. They're just so keen to help and so happy.
Yeah, and what a nice thing to hear. Dare I ask, is there somewhere you'd highly rate as good tapas in Dublin as a Spanish person yourself?
Haven't actually tried any tapas
You
yet.
haven't?
No,
No,
but they've
okay.
recommended me Lola's tapas.
Yes, I've been, and I can say ignorantly as an Irish person, it's lovely, but I'd love to get a Spanish rating. So when you go, let me know and give me your full and honest review.
I will.
Yeah, amazing, great stuff. Well, look, we might jump into a couple of quick fire questions that just sort of gets a flavour for how embedded you are with the Irish culture, and jump into the first one. That is, where is your favourite place to visit in Ireland?
So for now, outside Dublin, I've been to Howth, I've been to Wicklow, but maybe I would say I was in Galway and it was my first road trip, so that made it very exciting. And I spent a weekend there, and the vibe was really cool there. I really enjoyed my time.
Yeah, and if you're in search of tapas in Galway again, I can recommend the Black Cat. The Black Cat is a great spot for a lovely tapas down by Salt Hill, just outside of the city. So you might have to venture out there again. Great stuff. Tell me, next one, favorite Irish celebrity?
I'm gonna say Paul Mescal. I knew
Okay, great
from Wicklow
choice.
before.
Yeah,
Yeah, and now I still haven't gone to sing Gladiator. It's on my bucket list.
very good. And did you come across Paul Mescal before moving?
Yeah. When I watched Normal People.
No, okay. And normal people got all the way out to Spain too. God, he's all over the place. So he's our yeah, star actor that has tackled a whole load of different roles across the world, and his name is known far and wide. Next up, in terms of Irish slang or Irish phrases, that I appreciate you're still only here about 5 or 6 months, but is there any term or any phrase that you've come across that thought that just doesn't make sense to me, or that you're scratching your head thinking, what are they saying here?
There's a few of them really, but the first time I heard like it's gas, I was like,
Yeah,
what does that mean? Like for the context, I could understand it was something that was maybe shocking or cool, but I couldn't really tell because it actually like what does it mean? And I've heard it used for both for people, for things like cool things or just shocking situations. So it's funny. It's a funny word.
do you find, have you used that yourself?
Not just not yet, but
No.
I started to use the I'm grand and
Very
cheers
good.
whatever.
Yeah. For everything. And even my little 2.5-year-old says cheers now. So we train them in early when it comes to cheersing, whatever the beverage they have in their hands. Very good. And then in terms of home comfort, is there something perhaps that you brought from home, or you go to a local shop that just reminds you of Spain whenever you're feeling a bit of homesickness, perhaps?
Here in Dublin, there are two stores that have products from Spain. One is Taste of Spain, and the other is Mercado Olé. So you can find anything you want there. Also, every time I go home, I bring back some ham. It's a must.
Yeah, jamon. Yeah, I'm a big fan of Spanish jamon too. Have you tried to bring back a leg of ham from Spain?
Wow, I don't know if they would let me through.
Possibly not. Worth looking into. Worth looking into anyway. So I guess moving on then, how have you found this whole experience has changed you both personally and professionally? Because we take it for granted us living here, but it's a big deal. You're moving, even if it is a couple of hours on a Ryanair or Aer Lingus flight, you're still moving your life and changing your life to a degree. How have you found that overall experience and how that's changed you?
So personally, I think when you do a change this big and you just jump, once you've been here for a couple of months and you see yourself, you're happy, it's really reconforting, and you say, wow, I've actually been so brave, and that's really
Yeah.
something. It makes you grow. And professionally, as I say, right now I'm working in the emergency department, and this is being so good for my training, because I finished my specialty. It was 4 years in Spain, but I did rotations around the whole of pediatrics, so I haven't been working so long in an emergency department, and it's amazing how quick you learn and how much you get to know, and to it's been great. Honestly, I'm really proud of myself at this point.
Yeah, and absolutely, as you should, particularly jumping into a busy teaching hospital in Dublin. You could, others might end up in different parts of the country in smaller hospitals, but you're jumping into one of the busiest pediatric hospitals in the country, and as I say, you've gotten some. It's paid off because you've gotten some really good experience off the back of it. Where to do you think from here? Where is Laura's career going to go from working in Crumlin, do you think?
So I still don't know. I have to figure it out. But my contract was initially for 1 year, and all I can say is that 5 months in, I'm already thinking about staying longer.
Amazing. Yeah. And like, do you know how powerful that is, having such a supportive team around you and having an environment that you enjoy working in? And yes, of course, it comes with its challenges, but to have that feeling, I'm happy to go into work today and happy to stay beyond my contract because I'm really getting a lot out of it. And that's a great thing to be able to achieve, particularly in your first job here in Ireland. So that's amazing for us to be a part of that journey too. So thinking of others who could be listening, there's some, no doubt, who are on the fence about moving across to Ireland. What advice would you give them about the move?
So first, I would tell anyone to just jump, okay, and make the best out of it. In terms of what could be useful beforehand, I think I always spoke about the language, and also I would say a big issue here in Dublin is finding accommodation. In my case, it was very easy because I moved in with my friend, but I know from others' experience how hard it could get. So I would say to come in advance, maybe one month before starting the job, to find accommodation, because you have to be here to visit the houses. It's very difficult from
Okay. Any other bits of advice?
and just go ahead, and it's a great experience. Like, moving abroad, it brings you lots of good stuff, and the worst case scenario, you can always move back. In my case, like, Spain is a 3-hour flight, and I get to go home almost once in a month, so I'm not getting homesick at all.
Okay. Yeah, that's amazing, and a great attitude to face into it. Just, make the most of it, and worst case, if it's a year or 2 years, it's great experience to get. That's amazing. Well, we'll leave on one last piece, and that is, what have you found is the best part about living in Dublin, in Ireland?
I'd say the pubs and the live music, and how people are out in the streets all the time.
Amazing. Yeah, we'll have to get that pint very soon, Laura. That's amazing. And again, thank you so much for sharing your story. And as you say, it's only the beginning of your Irish story, with hopefully plenty more to come. And who knows, jumping into a consultant spot in the not so distant future. Thanks so much for taking the time to come on to the podcast and sharing your whole journey to Ireland. And we'll catch you very soon.
Thank you for all your help.
For listening to this week's episode. If you like what you heard today, please follow wherever you get your podcasts. Want to kickstart your relocation journey? Reach out to the team on our socials at Matchmates.